Patients who've lost multiple teeth or who have significant problems associated with decayed teeth or with gum disease are in a situation that requires considerable treatment to address that problem. Today, there's an advantage relative to allowing for fixed reconstruction, and that's accomplished with implants. And these are new roots that are placed into the bone that allow for a prosthesis to be placed onto those roots so that your dentition is reconstructed. When we do a reconstruction of the full arch, either the upper or lower jaw, we call that procedure Smile On, so that you'll be smiling on for the rest of your life. And that involves taking out the diseased teeth, placing implants in the appropriate spaces, and then constructing replacement teeth, if you will. And then that is fixed to those implants that are in your jawbone. And it's fixed either through being screwed in or snapping on to those implants. What you end up with is essentially new teeth that look like natural teeth, function like natural teeth, and allow you to do whatever you'd like in terms of normal function.